Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
The Ministry of Health would like to appreciate Ugandans for their cooperation in ensuring that COVID-19 standard operation procedures are adhered to. However, it would also like to remind the public that cases of neglect tropical diseases are still many. And for that matter, the Ministry of Health, together with Ascend Project, would like to encourage all the people who have signs and symptoms such as swollen stomachs, swollen legs, also known as elephantiasis, and difficult in seeing or blindness, to seek treatment from the nearest government health facilities. Please remember to stay safe and protect yourself by regular hand washing with soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines and discouraging open defecation in your community to avoid flies that carry germs, reporting to health facility early when feeling unwell. This message is brought to you by Ministry of Health with support from Ascend Project.
Discussion this morning. I have two specialists in studios, Mr.
And good morning, viewers.
I just hope that I pronounced your name rightly.
You did.
I have a problem. I don't want to pronounce people's names in the wrong way.
You did it very correctly.
Thank you very much.
Yeah.
And you're very welcome. Now together with Dr. Kabatereine is Marion Natukunda, a Senior Communications Officer from the Ministry of Health. You're also very welcome, Natukunda.
Thank you very much, and good morning, viewers.
Okay.
And I'm glad to be here. I'm safe.
Thank you very much. Dr. Kabatereine, I'm happy to have you here. You come from an organization called Accelerating the Sustainable Control and Elimination of Neglected Tropical Diseases. In short, Ascend. Could you please just let us know briefly what this is, what you're focusing to, before we delve into the topic of discussion, which is COVID this morning?
Yeah, I will be brief. Neglected tropical diseases themselves are diseases such as bilharzia, such as trachoma, which are very common in our societies. And Ascend is a British-funded project which came to support Uganda to control those diseases. In the full world, Ascend is accelerating sustainable control of neglected tropical diseases. It is a British-funded project funding many countries in Africa. It supports about 9 countries and some other countries in Asia.
Okay.
Yeah.
So what are you currently working on with the Ministry of Health?
Yeah, we are supporting the control of neglected tropical diseases. As I said, we do hydrocele surgeries for lymphatic filariasis, for elephantiasis. We do TT surgeries, the trachoma surgeries. When eyes you are almost getting blind because of trachoma, we control bilharzia. There is another disease called leishmaniasis in Karamoja. It is highly neglected, so we support the control of leishmaniasis, and that's exactly what we do in the country today.
Okay. Away from the neglected tropical diseases that you handle, I am now also trying to find sense of your partnership with the ministry, what you're currently working on with the Ministry of Education, I beg your pardon, Ministry of Health, in this particular wake of the second wave. Yeah,
when you are visiting a neighbor and then the house gets fire, you support the neighbor to put off the fire. We came to control, the British people came to supported Uganda to control neglected tropical diseases. But before they could start, then COVID came in. And then they thought that they should support it. And indeed they did, and they have been supporting, now they are supporting radio talk shows on all radios of UBC and the 2 TV stations. And we also helped to give hand washing facilities in neglected areas, like those in the islands of Lake Victoria, those remote areas of Karamoja, those refugee areas, Lesen, Alua, and many other districts which are remote, because we thought that at least these close ones are well supported. But in addition, we thought that after giving them the hand washing materials, we also trained the people on hand washing. Hand washing is a simple thing, as we say, but it is never done. So we talked to the health workers to do it better. And in the end, we thought that we should support the ministry itself, Ministry of Health, to air the views about COVID, and this is the time when we actually need that information so much. Yeah.
Thank you so much, and welcome, Doctor. We thank you so much for that very good synopsis of what you do and way into the country. Natkunda, I'll come to you. With COVID now, and do you think there's anything about COVID now that Ugandans do not know?
I think they know everything. They know everything, and but sometimes you don't take it for granted.
Yes.
Especially if you know, information is power, and if people blind their eyes and do not want, or ears and don't want to listen to that message, then maybe they would think COVID is not going anywhere. But I think the message has been sung. The radios and TVs like you have put out information, and everywhere you go someone says, please put on your mask well, please make sure, like when I was coming in here, of course I was told, get out of your car, come and sanitize, make sure your mask is on well, keep a social distance. As I was signing my name for registration, you see that even at the entry point of anything, someone is aware. So I think the drum has been sounded so much. It's just me and you to be very cautious.
Where then does that put us? Because we are in an era now where we are apportioning blame. We are asking who did not do right and who did not do what they were supposed to do. But then again, we of course realize it's with us in the communities, and it also depends on how we behave individually and maybe in communities in a way. But looking at the wave where we are now, people are trying to comply on a few things, and they're especially putting on masks. People are now learning how to put on masks rightly. People are learning to sanitize and possibly wash their hands and anything like that. We're failing on the other things like social distancing, because even when you notice this morning, as you're coming to town, driving to town, there were still people. They're crowding and then trying to find their way into the city, and they're like, well, come what may. Where does this leave us? What about if we possibly just say, let's comply, put on the masks up to about 70–80% of all of us putting on masks? What will this save us, and where will this put us in as far as the situation is currently?
And it's good you've come up with that people are putting on masks and then others are washing hands and sanitizing. But as you come, you see people are still moving together. There's no social distancing and all. I think it's something to do with behavior change, or people blindly just do not want to listen. But I think with what we have put in place as the ministry and even other organizations that are working with us, we shall get there. We shall get there, because now the health system is very firmed up now. I know you might take me back in that direction, but at least there's cautiousness and there's sensitivity. And you see sometimes someone pushes you away, or someone says, please move. What we need to work on now, I don't know, whether we are the ministry now need to divert and start describing how behavior should be for someone to avoid contracting COVID. But I think we are there where we can fight this, and it is going to go away only if me and you join the fight. Yeah.
We are in the second wave, and experts, of course, predict that there might be another wave, and there might be possibly a third wave. When we were into the first phase of this pandemic, we had things that we talked about. We had the stages of COVID, how it comes, the transmission, community. We're doing surveillance and all the things, and we try to do much of that. Tropical contact tracing. Now, COVID is with us. It's spread everywhere. Now, there's not a single household in this country that says we are still shielded and we will not have this problem, even in the villages, even in the rural areas. Let me first get to Dr. Kabatereine here and address me on this. People are also continuously neglecting the other sicknesses in the guise of treating COVID-19. And I want to just know the relationship with many of these neglected diseases and COVID itself. Because when they tell you about the symptoms of COVID, you notice that it has similar symptoms to maybe malaria and all those others. How are you finding it, and what would you advise Ugandans who are now shying away from hospitals because they know that once you go to hospital and you test positive, they will hold you there, and people want to stay in the houses to possibly do and see how to manage themselves from the homes? How would you advise them, those who have those other diseases that they're construing to be COVID-19?
Yeah, really, we have diseases which have been killing Ugandans without COVID.
Yes.
COVID is one of those which have come to accelerate death. Because I'm saying accelerating death, it is attacking almost everybody. You find that diabetes, you find the HIV, you find the TB. These are some of these drugs. They are diseases which are in the community and have been killing our people, and many others not mentioned. And if you don't get your drugs, you definitely go, because you don't know when diabetes will knock. You don't know. And for example, if you don't take HIV drugs, you get resistance to the HIV drugs, and you bring us problems in the whole country. It also spreads. It is a virus. You find that the TB, you must take your drugs.
Exactly.
And in fact, much as, and the president mentioned it, I appreciated that one. He said that you people who are also the security people who are contributing a lot, they should also consider when people are to get such drugs and so on, such people reporting to the health facilities. That's why he said that you talk to your LC and you can be on a motorcycle with something to show that you are going for these drugs. And I have seen some health facilities also, they have registers, they know their people. They call them, they talk to them, they remind them, this day you are, and I think that's the health educators who are doing it. I thank the Minister of Health. They call you and tell you, this day you are supposed to have your drugs. Sometimes they even go ahead and give drugs to a motorcycle person to drop.
Sure.
So these other diseases must not be neglected because of COVID. COVID has come to add to the diseases which were there, and we must control both.
Okay.
The oral diseases and the COVID.
Okay. Thank you, Dr. Narcis, because I know somebody who nearly died of malaria trying to treat COVID. Now, this person had not done an antigen test, they had not done a PCR test. They are not tested for COVID to know whether they're positive or negative, but because they were told that these are the symptoms and the signs of COVID. So when they felt that, there was malaria, of course, and when they tested, when they did the PCR test, the tests were negative, but yet again, the condition had not come to know because it was malaria. So when they tested for malaria, it was again too much. And so I noticed that malaria can kill somebody in the guise of thinking they're actually treating.
COVID,
yes, exactly. Because you can't steam malaria out of your body. You just like can't steam COVID out of it. Let me come to you, Marion, here. We also noticed that our health systems, just like it is anywhere in the world, there is no country that has a health system or facility that can accommodate everybody in such a time like this. When this had just broken out in the UK, they were struggling to save their NHS, and they were doing anything to ensure that Boris Johnson was ever saying, please, to save the National Health Services to them was because they know that COVID can be here, fight COVID and it goes away, but you still have cancer, you still have all these other things that National Health Services have handled. So we cannot have facilities that can accommodate all the people, especially in a pandemic like COVID-19 here. And because of that, you notice that many people have resorted to doing the home care best treatment and bit of it. What should be done in the homes and what should not be done? Because in the houses, all of us theologians, musicians, and we've now become doctors of our own selves. So you need to help us. How should people manage this home care best treatment?
First of all, basic. If one of the family members has been diagnosed or has gotten COVID, first thing first is to isolate that person. Isolate that person. And depending on how the home is set, I know not all homesteads have 5 bedrooms, 3 bedrooms, all that space that they can. And they look for the space because they're trying to prevent the other household members from catching COVID. So the first thing is isolate that person. And then in that, maybe get one person who is going to basically look after the person who has COVID. And of course, with the precautiousness around, is that I'll tell you, because just recently my neighbor had COVID, and we stay kind of in the surrounding. I use that as an example. And one of the neighbors came and told me and said, our neighbor up there has COVID. And one thing that we are doing as a community is that we are actually discriminating.
Which is very bad.
Which is very bad. We are discriminating those that would have helped. And you find even in the family, even maybe in your own family, they're also discriminating. So what I did, example of that is that I went there. Of course, putting on my mask, I'd sanitize, because when you get in my gate, you have to wash your hands and all that. So I went and asked her, I knocked on the door. But of course, I would talk from, shows that our doorway as a bit of a distance and putting on my mask. And I asked her, how are you doing? Any symptoms that, how long have you had this? When did you diagnose? And she said a week ago. How do you feel? I'm like, I'm just having body weakness. My chest is hurting. I said, are you on treatment? She's like, yes, I went for treatment. But I'm not that bad that I need to go to hospital. I can manage it from home. Then I asked her, do you have someone take care of you? She was like, yeah, there's a gentleman, her boyfriend, who was around. So now I had to switch my advice to the boyfriend, because this person might be worried about COVID and everything. So I asked the boyfriend, what are you doing to support this person? He's like, first of all, I have to protect myself from getting it. And indeed, he didn't get it, because he tested twice after looking after this lady, and he didn't get it. He said, what did you do? He said, I just have to make sure she takes her meds, she rests well, she exercises, and she's eating well, you know. And of course, now there's this whole thing, you have to steam, then you have to do garlic, then you have to do everything. Yes, those have been with us, even with the neglected disease we're talking about. Some people take that. They have been with us. But most importantly, is the person, first of all, managing the anxiety and the fear in the home is very important, because that is what is actually taking all of us. When someone gets COVID, everyone just runs away from the person. And then to start pumping all this information. I think COVID is not there. You see, the other neighbor died, the other person died. So you find that the fear is just too much. So these people were really, really calm. And she had to take, after the 1 week, called their caretaker, the doctor, the nurse that's recommended. She's doing well. And of course, with our help as neighbors. Then after 2 weeks, she went back for testing. And then she found that she was negative after that whole home-based care.
At what stage does somebody think that they are beyond home care management? At what stage do they need to get to that? Because we've seen many get deteriorated in homes, and by the time they think about calling an ambulance, when they actually at the 11th hour, and they don't even get to hospitals. So we just need to know.
Yeah, I think at the stage where there's fever, there's fever, the person has fever and is over coughing, maybe non-stop, and then there's they're having sore throat, or they cannot breathe, or difficult in breathing, because sometimes you might feel it coming in. Because I, for one, I got it, but I knew how the symptoms look like. So fever and constant coughing, and also if you have a bit difficulty in breathing. Yes. Dr.
Kawatirene, talk to us about self-medication, because I know this is a very big thing and a very big danger to you, the physicians in there. What has happened now is all of us have become doctors. We prescribe each and everything, and we do not consider the other things now. She will give you a testimony and say, when I got it, I did this, I did this, I did this, I took these antibiotics. Then everybody thinks now that is possible, the cure for COVID-19. So when they feel the signs like Marion felt sometime, then they will just possibly run, get that and that and that and that, without even knowing the doses and stuff like that. Talk to us about the dangers of self-medication in this particular pandemic where we are.
Yeah, the dangers is misuse of drugs, or of dosing yourself with drugs, and but the way I'm seeing, we have this is an immune-related disease, like any other virus. If your immunity is very good, normally you fight it. And 80% of the people actually have no severe disease because of their natural immunity. And besides, when they say self-medication, they are telling you that you also look at these immune boosters, like those fruits, you eat fruits, the lemon juice and so on, and you do some steaming and so on. And you take vitamins, multivitamins, and they also talk about the antibiotic, there's azithromycin, but that's where the problem can be. You should know that the azithromycin, you take it once and for a certain period, and don't misuse it, because if we misuse it, the whole nation becomes resistant to that drug. That's where you see my problem when it comes to an antibiotic. I see a problem. And the other way I'm seeing a problem is this lot of noise going around, that this plant chwas it, this plant chwas it. People claiming they have chwan here. Some of those herbalists, the herbs, they can damage you, they can damage the kidneys, and we have got to be very careful with what we take. Actually, we should. I'm worried about the herbalists, the way
the herbalists are also worried that you just intend to kick them out of business.
No.
They are very hesitant. That's why it's saying now you, the doctor, nurses, you are just jealous that people are now running to the alternative medicine.
Yeah, but. Let's be very careful on those herbs, how we take them. Don't trust that 100% that you have a medicine for for COVID. I don't know a cure today. Everybody is struggling to have a cure for COVID. We haven't got it. The herbs maybe might contribute, maybe, but my worry is if you take too much and they damage the kidneys, they damage other parts of your body, and you die, not because of COVID, but because of herbs. That's my biggest worry.
Doctor, you talked about drug resistance, and I think that's a very big thing. Let's put sense to drug resistance so far. I don't think, you just said it in passing, and I don't think people actually understood it. What's drug resistance and its negative effects, and people should know that. And we also had it before. Have we had a situation where we developed a drug resistance bit of it, because people need to know what self-medication can do to this country?
Yeah, we have had lots of drug resistance because of abuse of drugs. For example, chloroquine, that's one of the commonest. I'm using it because it is one of the commonest. It used to be very good at curing malaria, and in the end you find that for some time, majority of the people would not respond well to it. And that means it had developed some resistance. I talked about some resistance of some, let's say TB. You have heard of drug resistance TB because of these microbes. Also, when you underdose them several times, they survive. Then the survivors, they have known the experience of resisting the disease. Then they multiply and they become too many. The survivors become too many. And when they become too many, you find that the disease which used to be cured by the thromycin is no longer going to cure it, because the parasites, the microbes it is controlling have now changed into resistant ones, and therefore the drugs are no longer working as they used to work, and that is a danger.
Okay. Marion, on that particular one, please let me also hear your thoughts, because people have decided to get to, and I'll tell you why. About a week ago now, I also got a call at 1 a.m. and then they told me my mother-in-law is not breathing and all the things. And the next thing was find oxygen, because they knew I would actually find oxygen. And I actually found oxygen that night. I called somebody and drove from wherever I was to Bunga at about 2 a.m. in the night, went and got oxygen, then drove this oxygen to where my mother-in-law is. But I went praying that I don't use this oxygen, even when my wife wanted to see us have the oxygen with me. But I went praying. But because I knew that she does not know how to use the oxygen, I don't know how to use the oxygen. And unfortunately, we go to the home with a cylinder, but we didn't use the oxygen. We will actually not use it. And this is it now. We also hear there is what they call medical oxygen. There is also industrial oxygen. There are lots of the things, and people are administering these things onto themselves. We are at a time where everybody thinks anything that they touch on will actually help them survive. We've just noticed that people fear to die, and nobody wants to die of COVID. So anything that is at their disposal can be used to. Please just help us understand these things, especially in trying to do home-based care, but also treating ourselves to very sophisticated stages.
Yeah, and indeed, yeah, you're saying we're at a time where everyone is in a panic mode, and like I said earlier on, I think now Ministry of Health is of course emphasizing, and now we are working on what we call like the psychosocial support, like in counseling and all. And that is why I think at the end of the day we are going to put our emphasis on. Because you see, like your scenario, you went into panic mode, getting into oxygen, but the calmness of saying that I do not want to use this oxygen, let me wish and pray that by the time I get there I'm not using it. So our anxiety and fear is driving us crazy. It's driving us crazy, and we are not even seeking help. And we have the mental department at home at Ministry of Health, and we have our partners in Butabika. I know someone would say if you're going to call the mental department, someone say you've run mad. No, it's not about run mad. It's about seeking someone who's going to talk to you and comfort you. So this crisis, unlike how doctors say that we are really abusing drugs and we have gone herbal, which is okay, because as long as it is tried and tested and it has worked, it's fine. But of course, overuse, it damages other parts of the body. We've gone herbal, but the thing is that sometimes when someone gets COVID, the first thing they do is either like chase you away, or you isolate yourself, or you keep quiet. Because I've been seeing on social media, there's been a bit of advice where someone says, guys, when you get COVID, please don't keep it to yourself. Talk to someone. The symptoms may not be severe, but because you're in fear and panic, and you're anxious, you withdraw, hide, or keep quiet, and of course the virus starts growing into. Then by the time you wake up to go and look sick for health service, it is too late. And then that's when you start finding oxygen. And of course right now the health system is stretched. You've noticed, and I think you've been seeing, it is a bit stretched. And it is stretched because we're not listening to what we are being told. We're not listening to the social distancing, the putting on all the masks, you know, the staying at home. If it's possible, stay at home, and of course sanitizing. If we listen to those, I don't think we'd get into this panic mode and also stretch the health system that far.
Is the stigma for COVID-19 now the same as it was when COVID had just come into the country? Because when we had just started getting COVID cases last year, April, May, June, there was some stigma. Do you think it is still as it is today? Is it today? Do we have the stigma today as it was at that time? Or we are now learning that yes, COVID can catch anybody at any time?
I think now Ugandans have woken up, and the stigma has come now. Because, you know, when it had just come, the deaths were not as many as they have now. And I know that every family right now has been affected. Either family or friends, someone has lost a loved one. That's good. And now, of course, there's stigma in the homes, stigma at work, and at your workplaces. And you've noticed, if you come and say, Dr. Narcis has COVID. What? How? Where does it stay? Let me see. Let me remember.
I was with him in studios.
Was I? How far was I seated with him? How far was I seated with him? But these studio guys didn't warn me. I was on social distancing. Now I think I have it. Now you start perceiving it, that you have it. Yeah? That you have it. And then you start recollecting the symptoms. Even you start developing the symptoms, then you don't even have them. And I think I'm starting to cough. Then the nose. Then you start breathing in. I think you get what I'm talking about. So sometimes the anxiety makes you even assume that you have the symptoms of COVID and don't have them. But what I'm saying that then the deaths were not that bad. And because we relaxed, me and you in the community relaxed, and this thing hit us so hard. But of course we kept warning the public. We know COVID is, as we have fought it, the first phase. We fought it, it has reduced. But they kept saying there's a phase. And when our neighbors in Nairobi had the wave, they're like, those ones will handle. When it hit the borders and people started coming in, of course, truck drivers and everything, and then you had the South African variant, then we had the India, then we had the UK, and of course our borders and our airports are open. You can't stop that. The transaction and businesses and travels have to start happening. But when they mentioned the variant and people started losing loved ones in their families, that is when it hit.
Okay.
That you know what? Actually, this thing is serious.
Okay.
So the stigma, I think, either rose to a certain level, whereby now you stigmatize yourself, you who has gotten it, by isolating instead of getting help, and then also other people, the community stigmatizes it because there's been a hearsay that someone has COVID in the home.
Dr. Kawatireni, talk to us about the vaccination because, like she said in her opening remarks, people have heard about COVID. Yes, we've been with COVID now for a whole year and a half. People know how COVID came into Uganda. People know what to do. People know, even when they're not doing all the things, at least they know what COVID can do, how to know that you have COVID, and many of these things. We are now at a phase where we think to get vaccinated is one of the things that gives us some protection. And now, vaccination is not a cure for COVID-19, but it gives us some protection when it actually hits, and to see how we manage. We are looking at countries elsewhere where they are actually reducing on putting on masks because majority of their people have actually been vaccinated, as opposed to Uganda, where we've not even hit a million mark of, I think, vaccines. We've not even hit a million mark, so we are still below the standards there as far as vaccination is concerned. But let's talk about vaccination now. People have also got some phobia for vaccination, saying that if you went to vaccinate and you've not tested, then you are a candidate for death in the next few days. People are worried that going for their possibly second jab is actually going to cause them problem. Let's talk about this vaccination itself, and from the medical perspective and angle, and to allay the fears of the people. What do they need to do? Because people are perturbed. They do not know. Some are worried. They took the first jab and they are not sure whether they'll get the second jab on time. Some who are due for second jab are also saying when we go for the second jab, then we might die. We feared it when it was coming because of the clot business that had attached to it. Now it's about getting the jab and dying because you get the jab when you are positive. Could you please help us debunk on these myths that are there from a medical perspective for us to understand?
Yeah, first of all, there are many issues about the vaccine. Of course, some fearing that it has side effects. People came to kill us, and they are to reduce our birth rate and so on. They cause clot and die. You know, all of those sorts. That one, I want to say that vaccines are safe. When I came in, we were talking about football, and people are now returning to study, to stadiums to watch football, and we have said that some people are beginning to move without masks. I heard the president of USA saying it, and it is because the people complied with everything. Not only vaccines, they complied with wearing the masks, they complied with hand washing, they complied with the distancing. Well, the president has been describing all of those things, and all other health workers have been describing all of those things very well. Now the vaccine, when it first came, people shunned it, and now I think they have seen that really they need it. First of all, we have not had anyone die of a vaccine, and thousands and thousands have been vaccinated, including us, ourselves. I believe here everyone has been vaccinated. And secondly, the president and the government is working hard to make sure that the vaccines are available. I believe that those people who got the first jab, they will also get the second jab, because some drugs came in recently, and I believe that maybe today, or maybe I don't know when they are in the health facilities, but the people who are supposed to get the second jab, they will get it. And they are mobilizing from many circles. I heard from China, from USA, from even the Russian one, they talked that they can, so they will mobilize, and we shall have the vaccines. The Ugandans, once you have the opportunity, please take the vaccines. And take the vaccine and listen to the health workers. If they say you come after, is it 8 weeks or 6 weeks?
8 to 12 weeks.
Yeah, 8 to 12 weeks. If they tell you this is the date to come, you come on that date and you get another one. And in this mixed, we can get one where there is one with the jab, and that one, then you don't have to choose. All of these vaccines are good. Whichever one comes to your side, take it. And I'm sure the government is doing its best, and I'm very confident, feel that the government is not looking at closing schools permanently. It is looking at vaccinating our people so that we are safe and we can also go back to school. And when we get this disease, it is mild. The vaccine is not to prevent you forever, that you cannot get it. You can get it, but it will be mild. That's what they have been saying. But you will keep doing other things also to support the vaccine, and that way the disease will be brought to its knees.
How about the people who are worried that when they go to receive the jab and they've not tested, they're worried that it might be positive? And when they're positive and they receive the jab, then they'll definitely have to die. What needs to be told them?
You look here, the thousands have been vaccinated already. Did they first go for the test? Don't you imagine that there could have been one or two who had a vaccine, the COVID, and got vaccinated? Did he die? So if we are, I have not seen anywhere where they are saying first go and test, then you go for. No, it is not that. Testing is very expensive. Very few people are testing. Right now we are reporting we have thousands, which over 1,300 cases in a day, but you remember it is more because many people have not reported for testing. So we don't wait for that. You just go and get the jab at your earliest opportunity. Don't wait. That's the end result. The only message I would have for these people: get your vaccine at your earliest opportunity. Yeah.
Okay, Natkonda, let me come to you here. For we know that we do not have enough capacity to manage COVID and the way the cases are coming in. Now there was a report, I think I read it in one of the dailies, and they're saying we have about 2,000 recoveries a day. But that compared to the infections, then you notice that the numbers are actually low. And we need to, like we said, we all agree, we don't have enough facilities to properly accommodate everybody and to ensure that everybody gets it there. But even with an overstretched health system and with the less capacities to manage this, what do you think needs to be done on the part of the other people to save the facility, to save the health systems? What needs to be done by us? Where should our emphasis be, or where is your emphasis as a Minister of Health to see that you salvage the little that we have?
Of course, I like that when doctor emphasized about the vaccine, taking your dose of the first or the second, and of course it's available. And then two, staying home. We have now, I know we are in a lockdown, and of course the complaint right now is that now we're in a lockdown. What are we going to eat? How are we going to fend for our families and everything? Yeah, but right now they're trying. The lockdown is more of the restriction of the spread of COVID, and what we need to do right now, especially now that we're in lockdown, is stay home. I know someone's going to say why, but stay home, because right now you can't imagine. Of course, we are going to fall victim. Like want to visit. I know there's no movement of cars right now, of course, unless you're permitted. But people are walking. Where are people walking to? If malls are walking too. Yes, the malls are closed.
Chikubo is closed.
Chikubo is closed. Business centers, the bigger ones, are closed. Saloons are closed. Restaurants are closed. Gyms are closed. The places where you think people are going to congregate are closed.
Bars are closed.
Bars are closed. Of course, sports areas are closed. Betting where the crowds are always. The betting booths are all closed. And like you said, when you were coming, people were walking. So even perplexes you and me, and maybe the leadership of this country. Where are people going? So people are not going to the street. They are going to visit. I'm going to visit you. I'm going to visit doctor. I'm going to see some cousin. Now, you have not known your status of the virus. You haven't tested. Maybe not. Where you're going, it's there. Or you're carrying it. And see how we are infecting each other. Just because we are not listening to the directives of the president, His Excellency. And then, of course, the more we stay home in this lockdown, it's going to help us to re-strategize as Minister of Health and the health system of how to manage those that are severe right now. Because like you said, the hospitals are full. But how can you help us manage those that are suffering, or those that we can pick from the community to save? than you, how are you going to help us? It's you to stay home. And then also now there's a toll-free line. Yeah, there's a toll-free line. People are calling in and saying, I have these symptoms, I have this thing. If it is not that bad, we reach out to you. If it is that bad, maybe we call an ambulance or we call the helpline, and then somehow we connect. So it is me and you that are stretching the health system. And we are the vectors. We are the vectors because we are the ones who actually are moving this virus. Because if we weren't moving it and we're staying in one place, then it is, or if we are taking the precautions, of course. I don't want to mention the SOPs because they have really been sung. But of course, we shall not get tired of singing them. If you notice all our messages now, everywhere is SOPs and standard operating system. Someone said they want to listen to SOPs because sometimes that word is just getting to us. But we shall sing it. Because if we do not look out for those, that is why we are moving with the virus. So the vector is us, me and you.
Yeah, I wanted to add something very little about visiting. I have liked it, the way she talked about it. Visiting, unnecessary visiting. I remember right now I know 2 people who have, one of them is still surviving. She's an old lady of about 90. But she got COVID from visitors who come to see. We must change our behavior. People claiming we are coming to see the patient, we are coming to see the patient.
For now.
That one survived. The other one got COVID and has died. They had put there, don't visit, but the people would come and say, you don't want me to see it, so and so. They gave her COVID confined in a room there. By visiting unnecessarily, we have to change our behavior. Even going to see people who are sick, let's be careful how we go to see them. Let's not all rush there. Let's avoid this business of unnecessary visiting, really.
Dr. Kabaterine is still with you there. We know that the other spot for contracting this virus is especially at barriers. Now, when we talk about a figure of 626 deaths, we talk about what's documented in hospitals. We're thinking about people who are dying in villages. We think about people who are dying elsewhere. And maybe all the signs of COVID-19 were with them, and this person has died, but they've not died in a health facility. That the Marion Zia can actually help us put it together. What needs to be done? What should the people do there, even when they just suspect that our relative could have died of COVID-19? How should we behave? Because it's a very big problem, especially within the Muslim community, because of the way they treat and manage their dead bodies. And then to the rest of us is we feel so attached to our people who are departing, and we just don't want to say we are running away, shying, and let it be. So we will find a way. Advise the people now because our time is running out.
Yeah, I think barriers, really, we have to be careful. That's why I'm saying in this pandemic, we have to change our ways. We have to change behavior. And these behavior changes, specialists must help us. But they have done a lot. They have talked a lot. And you don't have to be so many to first of all, let people who, just the close family, they said not more than 20. Why do you want to defy rules? Even if it was not a barrier, they have said don't congregate. So many,
don't congregate.
Beyond 20. So anytime you become 20 and above, whether it is at a barrier, whether it is in church, whether it is, so please, let the immediate family get involved, and the immediate family also should care. You don't have now to go sing and bending, and let's bury our dead carefully, because we know we can get a disease. And the dead person does not want to leave our clan dead. So let's really change our behavior. If we have to survive, we must change our behavior. We must listen to people who are advising us. I liked also her, if she can repeat it, she talked to us and said she was recently in Korea, and the people were, if you don't put on your mask, what happens? Can you tell?
Yes. let's do that and actually also advise us because when the president spoke to us on the 6th of June, he said we now don't want to carry people, take them to prisons, because now that's again also outstretching our prisons facilities. And he was proposing fines for those. Do you think fines would actually do for us, like it has possibly worked elsewhere, for people to comply to these SOPs as we close down?
I think fines would do, because having crowding into the prisons, that's like the president said, to be worse. But if someone has been caught defying the directives of the president, His Excellency, and maybe and the SOPs that Ministry of Health has put, a fine would do, because if I am fined at a reasonable amount, yet I know at the end of the day also the economy and me and you is stretched. I'm trying to fend for my family, but I'm fine. Next time I don't think I'll do it, because no one wants to spend anyhow. To also go to jail, because also it's a reputation issue. Imagine having a convicted something because of violating what you could do, what you would have done, absolutely, and what you would have avoided. Really, they're telling you to avoid crowds, telling you not to congregate, and then you're paying a fine of about probably 300,000, 400, 500, 1 million. It's a stretch, and especially if depending on who you are and how some people can afford it, and they can do it once, they can want to do it over and over again. Yeah, but like he said, where I was in Korea, I was just, and I went, I think, in the time of the pandemic, in October there, and it was tough. There's no police, by the way, on the roads. To enforce. The cameras will report you. You're walking on the streets without a mask on you. The camera will capture you, and then they'll capture you and get to know. I think there's already, because already in the country, they trace your passport and everything, where you're staying, and then you'll get a warning on your doorstep, or where you're staying, because I was in a school, and they'll get your warning there. That is the first warning. But let me tell you what is very interesting, that even when you walk out, there's time you would forget with my students, and you're like, oh my God, I don't have a mask. You would run and go back, even if you're late. Even the bus has left, and if you run and get the mask. Because if you don't have it, the way people are looking at you in public and looking at you in the road, you will think that you're naked. Yeah. So it became part of the dress code. Though nowadays, of course, now as Ugandans, we started. If I came in this peach dress, I'm going to get a peach mask. But is that peach mask authentic? Is it having what can protect me, or it's about design? No, we should look out for those that are supposed to be protecting us.
Well, I want to thank you so much, Marion Natukunda, a senior communications officer from our Ministry of Health. Thank you so much for joining us on Good Morning Uganda this morning, and of course, thank you so much, Dr. Kabatirene, the country leader of for your role in helping us, of course, manage those other neglected tropical diseases. And we thank you so much for your effort of partnering now and putting your synergies together with the Ministry of Health. You started with a very good analogy of saying, yes, even if you're concentrating on your business here and a fire breaks out at the neighborhood, you can't say, we are planning a wedding, let them fight with their fire. You still come in to rescue and to be part of it. I want to thank you so much for making it here this morning.
Thank you very much.
And to all our viewers of our UBC TV this morning, my name is Jagenda Semakola Ziksoka. Happy Nams again to see how we can manage. Scripture says in Psalms 121 verses 7 that I shall preserve you from all evil and all harm. Now that's God's promise to then David, not all of us. We pray that God shall preserve us for yet another day, and let's see what we can do. Like you said, we will not stop emphasizing how to manage and to comply with the SOPs. Let's suffer now and live. Let's not want to live lavishly and again die. For God and my country, stay blessed. Good morning.
Good morning.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Fellow Ugandans, you know that the current COVID-19 period is a trying time in our lives. However, we still have another threat that has been with us for a long time, and it is called neglected tropical diseases, also known as NTDs. NTDs include bilharzia and worms that cause swollen stomachs. Trachoma causes blindness, and elephantiasis causes the swelling of legs. These diseases are affecting millions globally, and yet they can be prevented by regular hand washing with soap and clean running water, regular washing of the face with a soap and clean running water, keeping dirty hands away from your eyes, always using pit latrines and discouraging open defecation in your community to avoid flies that carry germs, reporting to the health facility early when feeling unwell. Remember to stay safe and protect yourself. This message is from the Ministry of Health with support from Ascend Project.
We've cut and reduced our MTN Momo withdrawal rates. Now you can withdraw mobile money at the lowest rates. You also get MTN Senchu points when you deposit, send, and withdraw MTN mobile money. Visit our Momo agents countrywide and withdraw mobile money at our reduced rates from 1st May 2021. Everywhere you go, MTN.